Delta variant is spreading across the metro, and it has local doctors on edge. Thanks for joining us. I'm Brad Stevens.
And I'm Carolyn Long. When we saw that 22 cases of this Delta variant had been found in Wyandotte County, we wanted to know more.
Turns out only a small sample of COVID cases get tested for variants, so the real number is likely much higher.
KCTV5's Betsy Webster joins us live now in KCK. Betsy, what has doctors so concerned?
Well, it's two parts. It's not just the growth of the Delta variant, but also its impact on those who are not vaccinated. Then you have communities like Wyandotte County, where that is a whopping 66% of the population.
I've heard people refer to communities like Wyandotte with very low vaccination rates as kind of being sitting ducks when it comes to the Delta variant.
That's the chief epidemiologist at the Unified Government Health Department. That variant is on the rise not just here, but across the country.
Right now, it looks like the Delta variant is becoming more and more prevalent.
To be clear, that KU Health System doctor and other experts say the Delta variant is not more likely than any other to put you in the hospital, but it does spread more easily. And it's not any less likely to put you in the hospital either.
Just regular COVID is bad enough to have a serious impact on our community.
Infecting primarily those who haven't been vaccinated, regions with low vaccination rates can turn into a house of cards, ripe for an outbreak. Here's a look at current vaccination rates in the metro by county, ranked low to high. Ray County, Missouri is the lowest at 27.7%. Followed by Wyandotte County, Kansas at 34.1. The rest aren't a whole lot higher, all in the 30s, except for Leavenworth County at 42% and Johnson County, Kansas, vastly higher at 52%. Who the virus is impacting is also changing now that so many older people are already vaccinated and younger folks not so much.
64% of the Delta cases that we've seen so far are people under the age of 30.
We are seeing more and more younger patients now needing hospitalization and have to go to the ICU and developing problems that could be 100% preventable if they were to get vaccinated.
So the message is pretty simple. Please get the vaccine, they are saying. It is free. And if you're adamantly opposed to that, they say please wear a mask, even though those government mandates have gone away. Live in Kansas City, Kansas, Betsy Webster, KCTV5 News.
Thank you, Betsy. And KCTV5 stands for you. We asked the Wyandotte County epidemiologist about concerns with the Johnson & Johnson shot and whether you might need a booster for better protection against this Delta variant. She says that is not recommended right now, but we should know more in the next few weeks. And this just in tonight, Johnson & Johnson claims their shot offers strong protection against the Delta variant. According to the Wall Street Journal, results from a small laboratory study look promising, but more tests are being done.
With the Delta variant spreading, will we see a surge in cases over the holiday weekend? Local doctors don't think so.
What we haven't seen, I think, over the last 18 months is these specific surges from holiday weekends. I think it's more overall of a continued lessened restrictions, continued people getting together, and continued vaccine hesitancy. And so, I think everybody should have a good time, do it thoughtfully and responsibly, do it outside if you can.
President Biden set the goal of getting 70% of adults partially vaccinated by the 4th, but we'll fall just short of that. Right now, 67% of adults have gotten their first shot. That number is 62% in Kansas and 56% in Missouri.